name is Julie. I am the lab manager here at Logansport Memorial. I've been employed here at the building about 28 years. We currently have our main lab area as well as 2 draw stations in the building, one located on the main floor near the medical office building, and then we also have a draw center down by the Women's Health Center. In addition to that, we bring in all the samples from the outside clinics located in Rochester, Camden, Peru, and ExpressMed. January has been selected as the National Blood Donors Month with regard to most people don't have time to donate towards the end of the year due to holidays, due to illnesses, just because it's flu season. And so you still have needs in the community, and that's why January is highlighted as the National Donor Month, just because they're trying to increase their donations based upon their usage at the end of the year. We find that, if people are willing to donate, each donation benefits 3 individual people. Every donation utilizes red blood cells, platelets, and plasma. Each one of those products is vitally important to the treatment of patients in various disease states, cancer treatments, anemia, accidents, and so forth. So we really encourage people, if they can kind of get past the scary point, that they're really doing their community a huge service. Yes, if you want to come in for a regular blood donation, you'll donate approximately 500 milliliters of blood, and within that, they will process the sample and split off the red blood cells, then the platelets, and then the plasma, as mentioned previously, for the 3 products. If you only want to donate platelets, that's called an apheresis donation, where they will pull off a certain amount of blood, spin it down, and then give you back your red cells. Yes, if you want to come in for a regular blood donation, you'll donate approximately 500 milliliters of blood, and within that, they will process the sample and split off the red blood cells, then the platelets, and then the plasma, as mentioned previously, for the 3 products. If you only want to donate platelets, that's called an apheresis donation, where they will pull off a certain amount of blood, spin it down, and then give you back your red cells. Yes, the blood centers require that the individuals be at least 16 years of age and that they weigh at least 110 pounds. It depends on the medication, so when an individual arrives at a donation location, they will go through your medication history, and depending upon what medications you're on, will either eliminate you or defer you, or you will be able to continue on with the donation process. As a full blood donation, you can donate every 8 weeks. If you're donating platelets only, you can actually donate every 7 days. You just want to eat healthy, hydrate that morning of, bring your ID with you if you're a first-time donor. We ask that you come in. It may take just a little bit. Just be patient, and we appreciate anyone coming in to at least start the process. They ask that you just kind of take it easy for the rest of the day. They will apply what they call a pressure bandage on the area from the location. They do ask that you leave that on for at least 3 hours, and to avoid lifting anything heavy with that donation site. Sometimes if an individual has not maybe eaten enough that day or consumed enough fluids, they may be lightheaded after the donation, so we do encourage people to be hydrated and have a nice sized meal before donating. That's basically the biggest side effect that you'll see, is some lightheadedness, maybe feeling like they're going to pass out. We try to hold blood drives every 8 weeks. And it kind of depends on the weather and the current status of the hospital with the flu and the COVID. But we try and stay consistent with that 8-week donation to maximize the capabilities of our donations in the community. We've been pretty successful throughout the years. Sometimes we have just a few, sometimes we have a little bit more, but we always want to stay consistent in the opportunities. You can walk in off the street. We actually post it on our Facebook page. We do encourage anybody who has previously donated with us, whether they be an employee or a patient or just in the community, to come on in. The news is there's lots of donation areas around the community. You can look on the American Red Cross for their donation locations, and then ours is done by the South Bend Medical Foundation, and you can also access the Give Blood website, and they can tell you where and when those donations are available.